Concerns about a possible swine flu pandemic are sending folks streaming now into crowded emergency rooms as well as walk-in clinics. Not with swine flu, but in many cases, swine flu jitters.
Many of you have emailed us your questions, and Dr. Darren Waters joins us again this morning to give us some answers to those questions and maybe some feedback and ease some concerns, perhaps.
Good morning. Thanks for joining us again.
Thank you.
All right. Well, we'll throw them out here to you this morning. Now, this is a first question where a viewer asked, is this the same strain of the swine flu that has killed folk in Mexico, or has it mutated, and that's why Americans seem not to be as susceptible?
It is the same strain that you find in Mexico. It's the H1N1 strain. It does mutate, but it has not mutated to the point where there's a difference between the Mexican strain and the one we see in America. The reason why you don't see so many deaths in America, I believe, is just from better health care. And plus, there's not as much crowding in America, so you don't see the transferability of the virus.
And one of the questions, part two of this question, talks about, does it diminish in strength at all as it's being passed from person to person? Or is it mutate? What's happening to it?
Not really, but it can mutate. And that's the whole point of what makes influenza so hard to treat, is it can mutate from person to person. And in fact, that's how it developed the swine flu in the first place, is it mutated within the pig. So it can mutate, but it can go both ways. It can become stronger or weaker. So that's really, it can go either way.
All right. Well, Gary Eller wants to know, is there any proof that this is linked to swine at all? He says that he's worked in the swine field for over 20 years now, and he's been around many flu outbreaks, and he's never gotten sick. He's also very concerned about the long-term effect that this will have on the swine industry.
Right, and I agree with him in the sense that there is an effect on the swine industry. I think they've already seen quite a loss in their revenue. But it is linked to swine. You do see this in swine. It's the same strain that you get from swine. Normally, you work with pigs. It's not transferred to humans, but this virus has mutated to the point where it has transferred to humans, and that's what's going on. And people who work closely with swine are more at risk of getting the swine flu.
He's been very fortunate.
He has been fortunate.
Yeah. Another viewer, Carla Tier, has a concern about her granddaughter. She says, my 2-year-old granddaughter has most of the symptoms of the swine flu. Her highest temperature was 105.7. On Wednesday, she had a regular flu swab and then a swine flu swab test as well. The results of the regular flu swab were negative. So does that mean she's negative for the swine flu as well?
She is negative for the swine flu. If you have a negative flu swab, you don't have the swine flu. If you have a flu swab and it comes back positive for influenza A, that's when you get worried about the swine flu and you send it for further testing. And in fact, if it comes back positive for influenza B, you're also done. You don't have the swine flu. So in her case, if she had a negative flu swab, I'd feel comfortable saying she does not have the swine flu.
All right. Well, here's Sandra Tewalt, and she wants to know, is a person post-lung cancer with COPD, and with COPD, more susceptible to the swine flu? And if they get the flu, can they get better?
Absolutely. Getting the flu is not a death sentence by any means. You're not necessarily more susceptible to getting the flu. What's worrisome when you have chronic obstructive pulmonary disease, which is COPD, is the fact that that's the type of disease that causes you to get pretty sick from the flu. So what you worry about with that is you have a higher mortality rate by getting the flu. You're not more susceptible per se, but you're one of those guys who can get a lot more sick. So you just got to be more careful. And also, COPD patients are the ones you want to vaccinate. Those are the ones that need to get the influenza vaccination in the first place.
All right.
So, but you can get treated, and chances are you'll be okay.
That's a good news right there, is you can get treated. So, any more questions, send them our way, and we'll continue to take a look at them as this continues.
All right. Thank you so much for joining us, Dr. Waters, this morning. And, of course, some easing of some of those swine flu jitters that we reported earlier.
Hopefully so, yes.